that's this is the title of our presentation this morning, living with uncertainty, with specific reference to fear of cancer recurrence. And just for the purposes of the recording, I'm going to mention again that I'm joined by my colleague, Dr. Mairead Brennan, and also by my colleague, Patricia Doherty. So we'll just move to the first slide. So before I get into the presentation proper, I'd like to acknowledge with some humility, in fact, that the particular phase in the cancer journey that many of you find yourself at the moment, most people think that on the outside, having had the disease is the most psychological distressing part of the whole process. And it's certainly the case that with disease itself, that there is a lot of distress associated with the diagnosis and early parts of treatment. But it is the case that we know from research that there is, it's often in the aftermath of treatment that it can get precarious, psychologically speaking. There's a few notes on the slide here, and you may be able to identify with some of them. Not so much with Homer Simpson, I hope, but you'll note that he's actually in free fall. And that's a term that some people have used that explains the general sense of disconnection or reduced contact with the medical team. It's also the case that many people close to a patient's either friends or families or neighbors, they may be remarking to the patient on how well they look because treatment has concluded. And the implicit suggestion is that it's time to be moving on. However, a lot of the time on the inside, and what I mean by that is that the inner life of the patient, it can feel that there's a new normal that's presenting itself. And rather than feeling positive about the whole thing, and this post-treatment phase is known in the literature as the therapeutic break or the therapeutic pause. And this phase can bring with it confusion, alienation, and fear, and not least of which is associated with the risk around reoccurrence of disease. So my acknowledgement is that I'm speaking to you now. I'm speaking to an audience that I know that can be in the midst of this particular struggle. And I know that you're attempting to navigate this new normal as best as you can. And my hope would be that the information shared today, as well as the acknowledgement of the challenge that you're certainly attempting to meet, may help you map your way forward in a forthright and steady manner. So the topic today is living with uncertainty, and it's the emphasis on the fear of cancer recurrence. And so here is the kind of general roadmap of what we're going to be talking about. And we're first concentrating on the following sort of elements. Firstly, the definition of fear of recurrence, or FCR for short. And we'll talk a little bit about what that actually is. And we'll talk a little bit about the epidemiology, and then some of the research that's around the issue. And at that point, I'll hand over to Mairead to talk a little bit about the strategies that people can utilize in order to manage this particular issue. So, at the time of cancer diagnosis, there's a few things that most people will experience, and that's pretty common for the most part. Most cancer diagnoses are unexpected. And with that, there's a lot of significant emotional distress, especially fear. When we do distress screening at that point of diagnosis, at the beginning of treatment, those levels of distress can be very elevated. There's also distress and stress regarding treatment decision-making process, because that's based on the data that patients and doctor have available to them And patients often worry that they're making the correct decisions for themselves. Then there are challenges to one's sense of self. There's usually elements of grief and loss. But at the completion of treatment, there's usually this anticipation that illness is over, and you've come to know that it's time to perhaps get back to life as usual. But for those of us who've gone into the cancer journey, it isn't necessarily the case. And most folks now will have to face a kind of a new normal, so to speak. At the time of the conclusion of treatment, there is a kind of well, usually a lessening of contact with the cancer treatment team, and there's often there's often been a build up or a close connection with that team, and that begins to lessen because of the cessation of treatment. So it feels like that's another kind of thing that's actually coming to an end. And that can generate that sense, as that previous slide with Homer Simpson, that can generate that sense of free fall, that you're actually almost abandoned a little bit by the medical team, and fundamentally you feel on your own. It's worth saying though at this point that as an aside, that there are now a number of different programs. We at Cancer Care West run a particular program called Cancer Thrive and Strive. And that's a program for people who are about 3 months or so beyond the end of treatment. That's also the case that here at the hospital, at least in Letterkenny, they do a kind of a hybrid program called the Moving On program. And the aim of those programs are to help with the reintegration process back into ordinary day-to-day life. And these programs are helpful because they can address some of the difficulties that people would encounter, and they work across various domains. And fundamentally, those programs are alive to the sense that this reintegration process is not exactly a straightforward process. So, what is fear of cancer recurrence? Well, I came across this really good quote here, and it's a non-technical quote, in fact. And so the person said, it's like a whale that moves into your living room, and over time the whale gets smaller, but it never quite goes away completely. It's the tenants who you can't get rid of. Maybe it gets down to size of a magazine rack, but once in a while you bump into it and it swells up into your face again, like when you're having a mammogram or they call you back for your next review. So there's a few things before we get into fear of recurrence per se, what it actually is. Well, the concept of fear of disease progression itself has been talked about for many years. And this particular fear is a related fear to that. And it's related to the illness itself, or that it will progress with all its biopsychosocial consequences, or that it will reoccur. We see this in many other chronic illnesses, and the little chart to the right-hand side has a list of those. And so we see those in many chronic illnesses. And some of the ones have actually the most elevated risk and severity of symptoms include the following. Things like rheumatic disease, Parkinson's disease, inflammatory bowel disease. And you can obviously see that the cancer is in there as well. But the thing to remember is that fear of recurrence is actually a very expected, appropriate response to the real threats that are associated with diagnosis and treatment, and of course, illness itself. So similarly, the fear of cancer recurrence has been developed in parallel or as an offshoot to this as it relates to cancer itself. And so one of the more agreed upon definitions for the fear of cancer recurrence is the fear or worry that cancer will return or progress with the same organ or another part of the body. It's multidimensional. So, you know, in the fear of recurrence, it's a type of worry. And for the most part, it's a type of health-related anxiety in that it's not an abnormal development. And as such, it's not necessarily a psychological dis-ease. So it doesn't make its way into any of the medical manuals for diagnosing psychological illnesses or psychiatric illnesses. But what we can say, it does range in severity. It does range from sort of normal anxiety that people would feel transiently, right through to very severe anxiety. And know as well that this can kind of develop at any point following diagnosis. So a little bit about the epidemiology. So when we look at sort of epidemiology, which is the study of patterns and distribution of both illness and health, and when we sort of look at that, there are some studies that show that fear of recurrence goes as high as 99% of people. So, you know, I think that goes back to the point that I made earlier, in that it's a very appropriate response to the very real threat of illness. But in general, when we do look at the data, it's roughly between 20% and 74% of people who do have a history of cancer who experience this issue. And when we actually examine this in terms of intensity, it seems that there's either a moderate to high levels of distress in up to about 50% of survivors of cancer. When you look at specific vulnerable groups, that number can actually increase as far as 70%. And when we look at very severe symptoms, when people are grossly affected by anxiety, that will affect about 7% of folks. But, you know, kind of taken together, we're looking at well over 50% of people in survivorship that encounter this difficulty. And probably there's agreement that it's one of the ongoing, unrecognized and unmet needs in cancer survivorship. Excuse me. So this is an area that continues to need a lot more investment in terms of research and clinical responses, and I think that's why programs such as the Cancer Thrive and Strive program, or the Irish Cancer Society's Moving On program, are so critical in helping people navigate back into, I suppose, civilian life, we could call it. It's, as well as that, interestingly, when people have done some research looking at what health professionals do in response to this, there's one study that looked at the sort of psychosocial professionals, people such as myself and Mairead, and doctors, and those kind of involved in the psychology oncology realm. And what they found is that greater than 90% of those in the study found that managing fear of recurrence was at least somewhat challenging, and about 99% were interested in further training. So not only is it an unmet need just for patients themselves, but there's also an unmet need in terms of education and those who are involved in the psychosocial arena and the care of patients. And similarly, when we look at studies specifically for oncologists, that's the medical people themselves, those numbers actually end up being pretty high as well. So there was about 71% of those oncologists that were interested in further training. And just under half, about half of them found that, 46%, found that dealing with fear of recurrence was rather challenging, as we might expect. So again, there's lots of unmet needs in multiple domains in this area. So moving on, what is the time course? What is the time course of fear of recurrence? Well, what we know is that in the first year following cancer diagnosis, and maybe we've talked about a little bit of this already, overall distress is pretty high. And we find that in the first year, it actually starts to decrease slightly over while, and the general level of stress goes down. And the fear of cancer recurrence pretty much remains constant. But we do know it seems to decrease once a treatment phase is successfully completed. So, for example, following, say a successful surgical intervention or following chemotherapy or radiotherapy, we would see the level of fear of recurrence go down. But what it does, it tends to plateau and remain at that level. And what we see is that for about 1 in 3 patients, they'll report fear of recurrence up to about even 10 years post treatment after their diagnosis. So the bottom line is that this issue can be persistent. And I think it's worth saying that these figures are tentative because the study of this particular phenomenon is in its infancy. And we haven't yet examined fear of recurrence over the long term in patients who've benefited from a range of programs that I've just kind of spoken about. So perhaps it is in time that with the aid of kind of psychotherapeutic approaches and with education, the severity, intensity of fear of recurrence will in fact lessen and become at negligible levels over the course of time. So moving on to the idea of triggers, well, what kicks it all off? So what are the triggers that generate or stimulate fear of recurrence? Well, you can kind of know that coming to a cancer ward or going to a cancer center itself can be a trigger. Many of my own patients have said that actually kind of even going back into the hospital, the sights, the sounds, the smells. So routine oncology visits or routine cancer screening can produce elevated levels of anxiety. This is important to know because our treatment of cancer is evolving. And as we know, many of the cancers are starting to change into probably more chronic illnesses. And with that, there's going to be an increase in the degree of surveillance that happens. And also with that, the degree of medical visits. So we can anticipate that the fear of cancer recurrence is probably going to be there and maybe even increase as an issue, especially as we have folks who are living for much longer and very well over the course of time. But that course of time will involve surveillance and visits to kind of doctors. Other triggers include the actual anniversary of diagnosis or treatment commencement, and these can also be very significant for patients. Colleagues or friends or acquaintances who get diagnosed, or if someone unfortunately passes away from their cancer, that can also be a trigger. Side effects from past treatments, particularly those that lead to somatic symptoms. And again, and perhaps more poignantly, unexplained physical symptoms can be a real trigger for people. And this particular one ranks as the most significant risk factor in terms of kind of creating fear of recurrence or triggering fear of recurrence. So its main features. So, when we look at predictors and patterns of fear of recurrence, there was an interesting study that was done with women in the early stage of breast cancer. And this was with 161 women. And what they basically did is that they looked at fear of recurrence at particular instances in time. So they looked at what happened before having a mammogram and after the mammogram. And they pulled the data on women who ended up having unremarkable mammograms. So essentially negative mammograms. So they did some scales to measure the degree of fear of recurrence and they ended up with essentially two groups of women. Now you can see that the two groups of women here, represented by the blue and the red line. And in the blue line, you can see that the levels of distress are pretty high and elevated. And then there's another group, the red line group, and they have significantly less levels of anxiety. And what seems to occur there is that in both groups, there was a slight increase in fear of recurrence in the week preceding their mammograms, as you might expect. So, but once they've gotten the results of the mammogram, which were essentially negative, in both groups, their negative the levels of fear of recurrences plummeted. It decreased, and then it goes down a little bit for the next week or so. But what you see in both circumstances is that the levels of anxiety slowly return and at least have the same trajectory upward over the next month. So one of the interesting things that we see is that although the pattern is similar across the two groups, there is a difference in the intensity of fear experienced. One group seems to have significantly higher fear of recurrence scores than the other group. Now, what explains this? What they actually saw is that in the particular study was that the ones who were experiencing greater fear of recurrence had a greater perceived risk, and they also had what they called lower coping capacity or lower self-efficacy. And this is a psychological property that when someone is faced with some level of difficulty or adversity, they just don't feel that they can cope well by using their own resources or strategies by themselves. And they usually look to other sort of reassurance seeking behavior. In the less distressed group, those figures, those people were higher in terms of self-efficacy. They had more general confidence, and they had a higher sense of being able to cope, a greater sense of being able to rely on themselves, and they didn't perceive the risk. They perceived the risk much more objectively. So other studies have been done looking at risk, and in terms of what kind of predisposes people to experiencing more intense or more aggravated fear of recurrence. And sort of other studies have been done looking at this. And you will see that gender is amongst one of the suggested factors. And I know that this becomes a little bit controversial. So what I would say is that some other studies, it seems that women seem to have a greater risk than men in experiencing fear of recurrence. But other studies show that it's actually fairly equal. So what we could say is that the kind of jury is out. So when we look, for example, at breast cancer versus prostate cancer, it seems to be more common in breast cancer survivorship than otherwise. However, when we look at cancers in which the disease and prevalence across both sexes, there doesn't seem to be a statistical significance between men and women. But in other studies, youth kind of becomes an issue, along with those who have physical symptoms. Other factors are things like less formal education, those who are at risk in terms of family stressors, and those who have decreased social support and are feeling socially isolated. And in addition to these, people who exhibit lower optimism and those who have lower quality of life overall seem to be at greater risk. So when you put together the certain clusters, certain themes seem to emerge. And there's a few studies that suggest that amongst these characteristics that make it more likely to predict the likelihood of fear of recurrence emerging, And it turns out that risk perception, together with lack of optimism, are found to be associated with fear of recurrence. So if you have an unrealistically high sense of subjective risk, that might be a risk factor for developing elevated fear of recurrence. And so that might be a strategy for reducing this issue as we move forward. In symptom experience, there are studies that report a strong association of fear of recurrence with features such as pain, fatigue, body image problems. And so, looking at education might be a means to try and help people combat fear of recurrence, again, as we move forward. And generalized anxiety and other psychiatric conditions related to fear of recurrence occur in many studies. And what they found is in about a third to a half of young women with breast cancer and fear of recurrence are also likely to meet the criteria for a generalized anxiety disorder, and that's a pretty high number. One thing that is probably playing a role are those people with increased anxiety coupled with somatic symptoms, including pain. And there seems to be more subject to fear of recurrence as well. And the reason for this could be that when we look at the actual physiology associated with some kinds of anxiety and its biological circuitry, many of the kind of brain chemistry involved in that are the same for both fear of recurrence and other physical symptoms. So there's a crossover, if you like. So my last slide is this. So some take-home points. Well, the first thing to say is that fear of recurrence is not irrational, and it's most certainly linked to existential issues. It's also worth saying that the goal of any intervention is not to get rid of fear of recurrence completely, but the goal is to pay it less attention as much as possible and give it less importance and to try to live as optimally alongside the fear. Another strategy is to set goals that really provide life with purpose and meaning and direction, and that you can do well. As well as this, normalizing and validating what you feel as not being abnormal. And it's certainly okay to have very, very strong feelings and not to buy into a pattern of self-criticism or self-persecution because this is something you believe you should not be experiencing. Part of sharing with others is to get out of this pattern of avoidance, which many of us can get into, and then process and make sense of our own experience. We talk to think outside the echo chamber of our own consciousness, and this can often lead to relief, self-awareness, and in the end, self-compassion. And it's worth saying as well that if you have concerns about physical sensations, or they seem grossly unfamiliar or out of step, you can always contact your medical team and seek appropriate education about what the symptoms may actually mean. And that can go a very long way to decreasing anxiety and worry. And also the use of cognitive behavioral strategies, particularly mindful cognitive behavioral strategies. These can all be used again to manage this particular issue. And Mairead in a few moments' time will be discussing what particular strategies people might find helpful. Okay, I think that's it from me, and I hope that has been informative. And so I'll hand over now to Mairead.
Now, are we good? Is that okay?
Yep, that's good, Mairead. Yeah.
Perfect. Welcome, everybody. Thanks a million, John, for that, and Patricia for looking after us and keeping us in tow. And just a little hello here from Galway. I'm based in our Cancer Support Centre here in Galway. And just as John mentioned, I'm going to focus on maybe some of those strategies that we can use that can help us manage that normal fear of recurrence and anxiety that can occur. And I suppose the whole process being that if we can better understand that human mechanism that occurs in terms of our anxiety, where it comes from, and what maybe maintains it, then maybe we may feel more empowered to be able to manage it as it occurs for us. So we're going to look at understanding anxiety using a cognitive behavioral therapy approach, which is the gold standard approach for managing anxiety. We're also going to look at creating some awareness and space, because even though there's a huge commonality in terms of how we respond as humans, there's also some uniqueness in terms of how we respond, what we bring to that. And so creating awareness and space for ourselves around how it fits for us and how it manifests in us is very important to have. And also then we're going to look at some of those mindfulness strategies that John spoke about. So for us to understand how anxiety or stress is triggered, it's like John talked about that triggering in one of his past slides, we need to talk about the processes, the different processes that occur. There's a situation that happens, so something triggers that. We have a thought process, and this is how we interpret the situation. We look at some of the emotions that might occur for us, and the way that we behave or respond, and how all these factors interact. So it's not a neat linear process as maybe the slide may suggest, but it's a process that's interconnected and that is unique to us. And there would be, as John talks about juries being out, there is jury out in terms of, some psychologists may think that, or may believe that the thought process occurs first, and then that sets off a series of the emotions occurring and the behavior occurring. But other psychologists would just say that the emotion is the start in their process. And I don't know if it's, if we need to lean into either which one. We just need to understand how they're all interlinked, and then being able to see how it occurs for us in a situation. So how we interpret a situation really does have a huge part to play in how we react to a situation. And this is a very important thing for us to note. Many things can affect how we see something. Like, how often have we had an experience with somebody else, with a friend or a loved one, and we've both walked away from that experience and maybe checked in afterwards on what it was like for them. And we realize that it's actually been somewhat of a different experience. They've remembered different things about it, things that maybe were things that, that they would have leaned into, or that they would have been more focused on. So we might be in the same situation, but we may see it or experience it differently. We have our uniqueness that we bring. So it's really important to see how we maybe view something. So we often make the assumption that we see things in the same way, but it's not always the case. Okay, we may notice things, as I mentioned earlier, that are more relevant to us. So, like, for example, have you ever gone out and bought a red car, and then all of a sudden you've started to notice all the red cars on the road? It's not that everyone went out the same day and bought a red car. It's more simply that you're more attuned to noticing the red car because you can relate better to it, or it's in your consciousness. And I often hear patients talking about when they received a cancer diagnosis and became more aware of all the times that it was spoken about on their radio, or on the TV, or on the newspaper. They just felt bombarded by those conversations in a way that maybe they hadn't before. So they're more primed to tune into things that are relevant to them. And many things can affect how we see and react to a situation. That includes our mood, whether we're feeling low or we're feeling anxious, or maybe even feeling happy and relaxed. The way that what our fatigue levels feel like, if we've any pain or discomfort, or any other demands that we may have in place at the same time. For example, like if we're feeling anxious or feeling tired, feeling stressed, and someone banged the door accidentally or made a noise accidentally, we're more inclined to jump. We might become more overwhelmed or maybe reactive a little bit more, maybe a little bit stressed or cranky. And because in that situation, we are more heightened. Well, if that happened at a time where we're feeling more relaxed, or demands were low on us, or maybe we weren't feeling tired, then maybe we would react in a completely different way. Maybe it wouldn't be as impactful. And John also leaned into this a little bit earlier on how our interpretation can be colored by past events. And he spoke about that when he talked about being triggered. That maybe upcoming review appointments maybe triggered that anxiety that occurred at the start of your diagnosis or at different stages of your diagnosis. So we need to appreciate that our past experience can greatly influence how we interpret the current situation. So the lens on how we see it. And this is really, really important. Even from an evolutionary perspective, it's very important. We cannot take in every bit of information that's in our environment and process it and assess it all at the same time. Our brains would be exhausted if we're doing that on every occasion. So what we do is we attempt to lean into what has happened in past experiences that are similar and bring that forward into this current situation. So we're attempting to appraise new aspects, but we're carrying old, maybe, experiences. And this information can really shape how we think, how we feel, and how we behave or how we respond. And you'll see that from the earlier slide we had around CBT. So they're all interconnected. And this happens automatically and is unique to us. So it's really important to understand what it's like for us in the situation. And these are maybe quick and dirty examples how maybe this can occur. If you imagine, if you see a Christmas cake, what does that bring up? How do we think about it? What feelings come up? How do we react or respond? And for some people, and this is very, mundane or banal, example, but for some people, that might be something that really evokes an excitement or a looking forward to. It may make us feel relaxed. It may make us remember all those past lovely experiences we had around Christmas and make us look forward to the next Christmas period. But for other people, if their past experience of Christmas have been difficult, maybe it's a time where you received your diagnosis or someone in your family became ill or died. And so Christmas is maybe connected with different feelings. Maybe for some people, it's something that evokes sadness, a tiredness, and anxiety. And this is unique to us based on our past experience, but important to know for ourselves. Because sometimes we have that experience, we have those feelings, and we're like going, why is that there? It causes confusion. It causes us another level of anxiety because we don't know. There's an uncertainty or lack of control around it. So having a greater understanding can be helpful for us to know why maybe it's coming up right now. Another banal example is this little kitten. For some people that might, give a little, an awe and excitement, or just make them feel relaxed. But for other people, it might evoke something completely different. And it's not just where we go to in terms of remembering or the thoughts that it brings up, but it brings up something physical in our body as well, that connected feeling, that connected physical sensations around it. And, I have a neighbor that has such a fear of cats that even if she sees them at a great distance, across a field or across a road, she actually can faint, because it just automatically, because of her past experience with a cat, it evokes that response in her, a very, very powerful and scary response for herself. But considering she understands it, then it makes it a little bit less scary for her. And John spoke about this earlier, and I mentioned it also, is that stress response is very natural and we need it. It's not a skill that we can do without. It's something that we need to be somewhat vigilant so that we can keep ourselves safe. We do a quick appraisal. Am I safe or unsafe in this moment? And that's what, starts us into that stress response. It's mostly automatic. And it may be something that has happened for us in the past, or we might know of indirectly through some other source or through somebody else. Like, not all of us have met a lion, but does it evoke some type of response in us? Do we, instinctively have a reaction, a physical one, where our stress response kicks into action? Our heart starts beating faster, our muscles start tense. We might feel like an urge to run or to fight or flight with the stress response. Natural thought might be, this is unsafe, he's unsafe. We don't know, he might come and he might be really friendly, but instinctively we say, this is not safe. And we're going to err inside a caution. Well, I know I am anyway. And even though I've never met a lion, I'm going to run and not hang around. So we have those past experiences that automatically trigger this. And as I say, it's very, very healthy and very instinctual and very, evolutionary accurate for a survival. But I suppose what we really need to attend to is, can we learn to differentiate? Understanding that process of stress response as occurs for us, can we learn to differentiate from times where our stress system is accurately evoked or activated, and times where it's inaccurate? But can we learn to manage that system as it's needed? So by learning how we view things, our perception, our past experience, and our current state can influence how we both evaluate and interpret situations, can help us to learn to see things more objectively. Can we create space? Can we step back and understand, why am I being triggered right now? Why is my stress system activated? What are the thoughts I'm having? What past experiences may be triggering that? Or what needs to be activated right now? Or can I put my system back into relaxed? Because often what we find is that if we're anxious, the stress response is triggered and we're anxious, our thoughts are going to be anxious. We're going to look through the lens of anxiety. And the more anxious we are, the greater risk there is that our thinking is inaccurate rather than objective. So we're not seeing things for exactly as they are. And these are called thinking traps, the automatic thinking patterns that we can fall into when we're anxious. And as I said, it starts us to inaccurately think about things. And different thinking traps include things like we can catastrophize. We can start trying to read the future. And we can start having tunnel vision. So we only see things that maybe are confirming the way that we're feeling, the way that we're thinking. And I remember a patient once sharing an experience that really kind of captured this. And she was in the hospital waiting on a review appointment. And as you know, sometimes in a hospital, you may be waiting a while for that appointment. And she was waiting outside the consultant's room. And she noticed over that time, she was feeling naturally anxious herself coming into that situation. It was triggering her anxiety or stress response. She was starting to remember when she came in first and had her initial diagnosis and the different times she'd been in with the consultant as well. So it brought forward a lot of thoughts and a lot of emotions to that day. And while she was sitting there, the nurse at the CNS that she knew was coming in and out of the consultant's room at different times. And she often tried to catch her eye as she went by, just to, see a friendly face, familiar face, and get acknowledged. And on this particular occasion, while she was waiting there over an hour and a half, each time CNS came in and out of the room, she didn't connect with her eye contact. She didn't connect with her. And while she sat there, she tried to interpret what was happening, why she wasn't looking at her, why she wasn't giving her a reassuring nod or a smile. And in that, her appraisal was, she sat there and started thinking the worst possible scenario. Started thinking her anxiety, well, this isn't good news. She's avoiding eye contact because she knows I'm coming in and she knows that, what they have to tell me is going to be difficult. And she sat there for an hour and a half, building on that fear, thinking and thinking around that anxiety. And I can completely understand why that was happening for her. But it was one example of where she was really focused in on those cues that were feeding into her anxiety. And as it so happened when she went in, she was given great news, everything was going as planned, and her next review appointment was in a couple of months. There was no need to interpret how her CNS was. It was simply that she was so busy and something going on herself, the CNS had, that she wasn't able to stop and pay attention to the patient. And it's not to say not to do that, it's very natural. And following a cancer diagnosis and once treatment is finished, patients often say how their systems continue, their stress systems continue to be in an activated state. And they're very vigilant to any signs or indications that the cancer may have recurred. And patients often say how they can feel frustrated with loved ones who tell them not to worry, because it's actually an impossible ask. And one patient eloquently coined the phrase of living with a shadow. And it's a little like John's whale, blue whale, to describe how she felt, that it was there with her at all times. And she couldn't ignore it, but she had to learn to manage it. And it's very important to be aware of any signs or symptoms that may indicate recurrence. And with worries of recurrence presence, one may be a risk of misinterpreting neutral and normal aches and creeps that occur in our bodies and set off or maintain the stress response process. So it's very important for us to be able to step aside and maybe evaluate what's happening for us and how we are connecting with it. One patient used the analogy that helped him about likening it to how a house usually had many noises such as gurgling pipes or dripping taps or creaks and moans. And we don't always notice these during the day because we're so busy and maybe the noises are drowned out by other things. But at night we may more hone into them and they might think about them more, and the louder they can appear to be, the more we think about them. And we also might start thinking about what possibly major damage is about to occur or is occurring. And for him, he described that as after the cancer treatment, normal aches and groans and bubbles that were often there for him, he was more likely to interpret them as something sinister and becoming more anxious and with that. And the more naturally, the more our body reacts, such as with tiredness or muscle ache and muscle tension that can occur when we're feeling anxious, it can feel like that pain is compounded and it's even higher, and that validates our fear, so it can set off this whole process of our anxiety become more and more heightened. And then also, as I say, as those muscle aches become more heightened, it validates. Maybe there is something I need to worry about. Maybe something is occurring. So it can be really helpful for us to have a protocol, you to have a protocol in place to manage this worry. As I say, it's a natural occurrence and it's something that you need to be aware of. Have you ascertained maybe with your medical team around the signs and symptoms that you need to be aware of for yourself? And if not, as John mentioned, always connect with them at any stage to get some reassurance so that you know what you need to be aware of. If we have an ache or pain or something you're worried about, is it something temporary or constant? Does it come and go? Are you noticing that it's dependent on how you're feeling? Is it more likely to be there when you're anxious? Is it more likely to be there when you're feeling low? Is it still there in the same way when you're enjoying something or relaxed or busy doing something? To check in to see if it's coming from how you're emotionally feeling or if it's something that's there underneath. It's also important to be aware of the ongoing treatment, those long-term effects that may be staying with you post-treatment, tiredness or aches that may be occurring. Are they present and what their role is? And also being able to maybe create a healthy life balance, working on stress management in terms of, are you exercising? Are you sleeping well? Are you eating well? Are you keeping stress, getting the right balance in terms of demands? Are taking time to allow yourself to recover before you take back all the other roles and responsibilities you held in the past? And if some of these signs or symptoms and fears still remain there, can you put an X on the calendar in which you feel it's time that you'll contact your healthcare professional? And an example being that if someone, if a patient, they say, I'm feeling tired, and I'm feeling a little bit off, I'm not sure if it's a cold or flu coming on or if it's something different. I'm not sure, and I'm not sure what to do. So we'd often say, well, what feels right for you? Do you need to connect your healthcare professional now, or do you need, such as your GP, your medical team, or are you going to give it a few days? So then over that time, you're able to tease through if it's something that was temporary or something that is still there with you. And we've talked all the way through about creating awareness in space. And as I said too in the past, that a lot of this process, our stress response process, is automatic. So we're doing it without even putting full thought into it. And with all the other things that we're juggling in our days, you may feel like the man there, that is, his mind is full, so we don't always stop and think and give ourselves space to tease through what is exactly happening right now, how my mood might be affecting something, how the situation might be affecting something. But giving ourselves that space to know what we're bringing forward from past events and how our emotions are. And the only way that we can grow awareness of our thoughts and our emotions is for us to be like the dog, if possible, to take that mindful approach where we're just in the present moment, checking in on actually what's happening for me right now, rather than rushing forward or thinking it. While mindfulness can feel like a very abstract practice that requires intensive meditative practice, that's not really what is always needed. What it really means is that we notice how we're feeling or thinking right now and choose or learning control what we pay attention to or how we manage those thoughts and those feelings. So taking a very much step-by-step approach, because the next moment and the next moment are more manageable if we take them step by step and attend to how we're doing right now, rather than trying to manage the next week or the next month. And just like the man in the last picture, this is typically what can happen for us. We can spend more time thinking about the past and the future and not enough time thinking about the present moment. And I think especially at a time of worry and uncertainty, we often look back to past regrets or past sadness or past worries, and we look forward to worries and to sadness. So it can always be connecting us with past or future thoughts that align with the way we're feeling. So mindfulness really means bringing your thoughts back to the present moment, rather than living in the unchangeable past or the undetermined future. Take a step-by-step approach, becoming more aware of how we're feeling and thinking and what we need today. Have you ever sat down at the end of a day and realized that either your feet were sore or your shoulders ached and were tense? And it's not that that's just occurred right now, the minute you sat down. It's something that's possibly been building throughout the day, but you haven't been paying attention because you've been too busy in the day and you haven't become aware of its presence in your body. And what if you were to pay more attention to it as it occurred, rather than wait until maybe at the end of the day when it's really heightened? And we can be talking there about those heightened muscle aches, or also about how anxiety can be growing and we're not paying attention. So if we allow ourselves the opportunity to check in at various times during the day, we might realize, I need to sit for a few moments, I need to rest. I need to stop and relax for a few moments to reduce my anxiety. Or I need to stop and relax and rest my body because I'm feeling pain, rather than trying to go throughout the day and not attend to it. It was quite difficult, but we're basically there. It really is how we can give ourselves permission to stop and think about the present moment, quieten our minds. Taking that real day-by-day approach. And as I mentioned earlier, it's not just, deep meditative practices that are the ways of doing that, because that's not always possible to integrate into our life. It's about taking those very basic practices to help us to focus our attention, our breathing, settle our mind, so that we can quieten it and become observers of the way that we're thinking in that present moment. What might we be thinking? Is that accurate? Is that inaccurate? What do I need right now? What might be triggering that right now? And as John mentioned earlier, that, being compassionate with ourselves, not criticizing ourselves. It's very natural for that to occur. As I say, it happens instinctively and it happens naturally, and it happens to all of us, and particularly after cancer diagnosis, our system is hyperventilating. So can we tease through those things that are maybe activating our system, allow it to rest, and allow us to take control of how we're feeling, so that we can maybe determine how we're going to react or what we need right now. And really it is about putting even our hand on our chest and our hand in our belly, and just noticing our breath as it comes in and out of our body. Just slowing it right down. Sometimes people say we want to take those deep belly breaths. So we're making our belly expand and then settle back down and push it back. But some people say you need to get a particular pace. Deep breath in, hold, deep breaths out. And it really is unique to all of us. All of those techniques work, but really I think the basic skill would be that we're connecting. We're just checking in. We're just putting our hand on our chest and on our body and becoming aware of that moment. We can check in and see how we're physically feeling, how we're emotionally feeling, what we're thinking. Are we falling into any one of those thinking traps? Are we bringing forward our past interpretation of events that may be compounding how we're feeling right now? Can we settle ourselves for this moment so we can see where we are at and make a choice to how we respond? So it really is about knowing ourselves, knowing the mechanism, being kind and patient with yourself, and looking after yourself in a step-by-step, moment by moment. Yeah. Thanks, everybody.